Dr. Nair, you want to talk a little bit about new treatments for atrial fib, and I brought these so you can show those.
So atrial fibrillation is an abnormal heart rhythm that comes from the upper chambers of the heart, the atria. So when you have atrial fibrillation, the top chambers go out of rhythm and they start fibrillating, so they start quivering, so the heart cannot pump blood properly from the atria into the rest of the body. So what happens is the heart, when the heart's fibrillating in the atrium, when the blood doesn't move, it clots up, and the clot can go into your brain and cause you to have a stroke. Usually we used to treat patients who have atrial fibrillation with blood thinners. So what happens is you thin your blood from head to toe, which keeps the blood in the heart thin as well. And in that way, the clots don't form and they don't go into your brain and cause you to have a stroke. But what happens is when you take a blood thinner, your blood is extremely thin, which means you can bleed. And that can cause a lot of problems, including blood in your stools, blood from your nose, blood in your urine. You can bleed anywhere because your blood is extremely thin. We have a new device called the Watchman device, and there's new other technologies coming out as well. It's a little device, looks like a little bird cage, is what it looks like. It's a little device that we implant in the heart. And what we do is we put a little IV in the leg, and through that IV we go up to the heart, find out the pouch where the clots are formed, and we implant that device into the pouch like that. And once it sits in there, the heart tissue just grows over it over a period of about 6 weeks. So a person is going to have to take some blood thinner for that 6 weeks, but after the 6 weeks, once that pouch is completely sealed off, then they do not have to take blood thinner all their life, which has revolutionized the treatment of atrial fibrillation. Usually it's a one-time procedure, and it takes off the blood thinner out of your pill closet.